who have emphysema will have more of breathlessness. Those are the extremes. So in between, you have a mixture of cough and breathlessness.
So are you saying now that it could take upwards of 2 years to actually diagnose COPD in a patient?
No. The length of time you are exposed to the damaging effect of smoke that causes COPD, that is where 2 years comes in.
Okay.
But if you go to hospital complaining of cough, breathlessness, difficulty in breathing, within a day or two, the doctor should be able to make the diagnosis. He needs to examine you, maybe do a chest x-ray, do a test we call spirometry, and then he comes out with a diagnosis within a day or two. It doesn't take even 1 week to make a diagnosis. It's a day or two, depending on the hospital, what they have, and all that.
How is this treated? When someone is now diagnosed with COPD, can he be treated to be well?
Yes. It may not be able to return the person to what the person was before it started, but at least you can halt further damage to the lungs. So the first step in treatment is stop smoking. Most of them are smokers, so they're advised to stop smoking. Now, this is very easy to say, but those of them who smoke will tell you how difficult and how hard it is for them to stop smoking. But that's the first thing. Then infection, pneumonia is often part of the problem, so they will need antibiotics. And then the group of drugs that open up the airway so that more air can come in, and air of course carries oxygen, what we call bronchodilators. Also,
these bronchodilators, are they the same ones that are used to treat asthma?
Correct, the same ones. The difference between asthma and COPD is minimal. Sometimes it will take a specialist days to distinguish between asthma and COPD. They are very similar, very similar, both in symptoms, diagnosis, and treatment. Very similar, very similar.
Are there other things like maybe breathing exercises that help the patient live a better life?
Sure, what we call physiotherapy or physical therapy. You want to improve the ability of the muscles of the lungs to take in oxygen. It's called rehabilitation. Yes, there are. Medication, counseling is part of it. There are other things like improved breathing exercises and all that, cleaner environment. But again, most of this may be beyond the healthcare personnel, like clean environment. That's beyond the medical people.
I'm interested in this breathing rehabilitation. Does it mean that this person is going to be breathing a different way from how normal people breathe?
No. Again, we're moving away from, but it's all related. Now, most big hospitals will have a physiotherapy department, or if you call physical therapy, they call it in America. Now, this is another area entirely, and they are trained. They have things that they use by training the patient so that the muscles get stronger and they're able to draw in air. You know, in airway diseases, asthma and COPD, the airway, instead of being wide like that, is narrowed. So the work of breathing is more, because the muscles will have to do more work, drawing air through a narrowed passage. So they're able to strengthen the breathing muscles so that a lot more air can come in.
I've seen video clips of people who had emphysema, and they go around carrying something on their face and breathing through it. Is that how someone with emphysema has to live?
No, that is the extreme case. And probably what they are carrying is oxygen. They're carrying oxygen. Now, because the oxygen in the air is not enough for them, because the barrier through which the oxygen enters has been reduced markedly, you need to increase the oxygen they are taking in to improve ability to go through the barrier. So it's called oxygen home therapy, home oxygen therapy. That's what they are carrying, and they are breathing oxygen. Just to improve the oxygen in the air, thereby improving the possibility of the little barrier that is left being presented with a lot of oxygen. so that they get more oxygen. So it's oxygen they are carrying.
But that now means that this particular person with this extreme case has to live like that. He has to always have that oxygen.
Yes.
And then have refills of his oxygen tank.
Refills of his oxygen tank, correct. Now, in the very, very advanced part of the world, they're doing lung transplant. That is, you remove the lung of the person that has been damaged.
We'll come back to that. We'll come back to that after the break. We'll take a break right now. When we come back, your calls, your questions. Welcome back. We're still discussing COPD. In case you've forgotten, that's chronic obstructive pulmonary disease. A mouthful. That's why we have to say COPD. Anyway, it's time for you to call in, ask your questions, or give us your experiences. The number to call is 012206-842. That's 012206-842. And the questions are for COPD. You were talking about lung transplant. They take out the defective lung and put in a new one. This new lung, is it a donated lung or is it a prosthetic lung? Is it a manufactured lung?
We are not yet able to manufacture lungs. It has to be somebody who donated his own lungs.
So how possible is it to have this procedure in this country where people don't like to donate parts of their body?
That is one problem, and to me, the least part of the problem. The major thing, just like blood transfusion, you have to match the lung you are donating to the person you are giving the lung to.
Okay, there's that also.
Yes.
That means that it's not every lung that can fit everybody.
No.
That's difficult.
No. And that is where the problem lies. Being able to identify a lung that the person you are giving it to will accept.
I believe we're having a call. Williams is on the line. Hello, Williams.
Hello, good afternoon.
Good afternoon. Could we have your question?
Yes, I just had you discuss problem. Most times I discover that if I have to do anything difficult, maybe I'm running a little or I will feel so difficult to breathe very well. So could that be a sign of a heart problem?
Okay, his question is, he gets tired easily after some exertion. Breathing becomes difficult.
Now, because you have difficulty in breathing, it could be a problem with the lungs, it could be a problem with the heart, it could be a problem with blood level. It could also be a chemical problem, what we call metabolic problems. So, to sort all this out, you need to go to hospital. A doctor will now examine you, probably do an X-ray, because like I said, they will need to look at your lungs, they will need to look at your heart, they will need to look at your blood level, and they will look at chemical problems, what we call metabolic problems. It's one of the four. So you need to be seen, examined, and investigated in a hospital to know exactly what the problem is.
Okay, so back to the topic of the lung.
Yes.
You have to match the lung to the person.
Yes.
But can the person's own lung be, for a better word, for want of a better word, can it be patched to work better?
Yes, and that is what we do when we say we are treating. You give drugs, antibiotics, bronchodilators. You are trying to help that person's lung to continue to function. Even the physiotherapy we're talking about, rehabilitation, all those are measures, antibiotics, all those are measures to help the existing lung to continue to work. Since replacement